Hi, we're going to be talking about the connection between law, social work, advocacy, and particularly mandated reporting. And to discuss this topic today, I have with me Dr. Kathryn Krase. She is a lawyer, she's a social worker, and an expert in preparing professionals in the ethical reporting of suspected child maltreatment. She is the co-author of two books, Child Welfare, Preparing Social Workers for Practice in the Field, and also Mandated Reporting of Child Abuse and Neglect, a practical guide for social workers. Over the past decade, the main subject of her research and writing has been the disproportionate representation of BIPOC children in reports to Child Protective Services and the role that bias plays in the making of those reports. So Kathryn, so much, thank you a lot for being with us.
It's my pleasure to be here. Thanks for having me, Ray.
Yeah. And, so at our institute, we talk to a lot of social workers and a lot of people looking to get into the social work field. And they, sometimes struggle. It's always a struggle. People have an interest in helping people in the overall field of helping them mentally and emotionally and the practicalities of their life. But aren't always clear on exactly what track to get into. And one thing that's really great about social work is there's so many different tracks, so many different things that you can do with it. So just so we can get to know you a little bit, can you share as to why it is that you chose to combine law and social work?
Sure, Ray. It's a question I get all the time because when people hear that I'm a lawyer and a social worker, they think there must be some confusion that they're hearing because lawyer and social worker don't seem to go well together, but they actually go really well together. I was in college in the late 1990s, and there was a big upheaval in Washington, D.C. about welfare reform. And I was very concerned about the efforts that were being made and the impact that those efforts were going to have on poor people. And I wanted to respond to that call. I had a life at that point. I was a young adult who was very interested in service to my community. And I had worked in many capacities in which I knew that these policies and benefits were really supporting families, keeping them from really disastrous levels of poverty. And so I was very nervous about the impact of those policies. And I was trying to figure out how to get into that world. How could I be somebody who could make an impact with people who might be affected by changes in welfare laws and rules? But I didn't know how to do that. And because I had an interest both in the policy side, like how can I help the policy develop in the right way? How do I help inform policy development? But at the same time, I didn't want to be a politician. So I didn't know how to go into that space and not be a politician or work for a policymaker. But at the same time, I also didn't want to just work with numbers and outside of the community and at a higher level where I was just looking at papers all day. I wanted to work with people. And I've got to be honest, it was my father who made the suggestion that I combine law and social work. And I was resistant at first because I didn't want to be a lawyer. That was never something in my plan. And I didn't want to be in the courtroom. That wasn't what I was looking for. But he instilled upon me that law would give me a frame of reference to better understand the policies and the processes behind making those policies that I was interested in. And that social work would give me that humanistic side. But when he said social work, I said, I don't want to be a social worker. Social workers are therapists. And again, that's not what I wanted to do. But as you said, social work is such a broad field that there's so much that you can do with a social work degree. And I didn't realize that when I was 21. But now, many years later, having taught in multiple social work programs, the undergraduate and the graduate level, I know there's so much you can do with a social work degree. And I never would have thought 25 years ago that my career would have landed me where I am right now.
Right. Yeah. And I mean, social work, the first thing people think of, at least I do, and I know a lot of other people do, is social advocacy, right? So helping people get their needs met, resolving issues in society, helping those who can't advocate very well for themselves. being an empowerment for those that really need help, all those things. But then some people come across the obstacle of the system, like they're fighting against the system, and they might not feel empowered to really make changes on the system level, legislation and policy changes, et cetera. So do you feel like the fact that you did get your law degree empowered you to make some of these system changes?
Very much so. What getting my law degree helped me do is better be able to communicate with the players who are making policy decisions. Mm-hmm. And that's why for everybody who's gotten a BSW or an MSW, you have to take at least one policy class. And I've taught those classes for 25 years, and I get a lot of resistance at first from students who come into social work thinking, why do we need to know about policy? And we need to know about policy because every single client we see, whether it's community at the community level, at the macro level, or micro level, working with individuals or families, right? They're all impacted by policy, whether it's healthcare policy, whether it's mental health policy, whether it's housing policy, income support policy, right? Even just the fact outside everybody's door, there's a road that's impacted by policy. Some neighborhoods and some communities get better treatment by sanitation services than other communities. And so having that legal background helps me communicate better about how policies can impact. Now, that doesn't mean that all social workers who care about advocacy and policy specifically need to be lawyers. Mm-hmm. They don't. Social workers can be very effective advocates even without the law degree, but the law degree definitely gives me a leg up when it comes to being able to communicate with people at those higher levels about legislative initiatives and implementation of policy. Mm-hmm.
Yeah, and on the flip side, politicians, attorneys might very well consider getting a degree in social work, right? The purpose of being a politician and the purpose of a lot of law anyway is to help society, help improve society, make it a better place. And I'm sure on the flip side, social work, your social work degree really informed you in regards to those issues.
And it's actually fascinating to me. I'm part of a network on LinkedIn of lawyers and social workers, and there's no people who have both degrees, and there is no one path to getting the 2 degrees. There are people like myself who did both degrees at once in a joint degree program. There are people who started with their law degree and then they were practicing in an area of law that made them realize that there were elements of what was happening around them that they didn't understand, and they were looking to better understand the theoretical base. And so they came back and got their MSW. And then there's the other side of things, right? Where people started out with their MSW and were working in systems where they realized that in order to be the most effective advocate for their clients, they wanted to have that law degree. And so I'm always fascinated by those of us who've chosen to do both, because we're not monolithical. We're not just one type of people. We've come to the same degrees, but through different pathways.
That's great, because you probably get a lot of different perspectives then in that group, which is really helpful. So now to mandated reporting. The emotions that I feel with mandated reporting is sad and scary, right? Like you feel so sad for kids that are in situations that they should not be in, that are not good for them. And then scary, like, well, what's going to be the impact of mandated reporting on the family, on the kid? What's going to happen if they get into the system? What's going to happen if they don't get into the system? What if there's a report and just the investigation, what impact's that going to have on the family? So I think a lot of clinicians struggle with that. That's why I'm sure you wrote your books, right? Everyone needs help with this very difficult subject. So what got you involved specifically, like specializing in mandated reporting?
Sure. So I kind of made a right turn from welfare law, and I came into child welfare more specifically shortly after grad school. And in that realm, I first worked for the New York Society for the Prevention of Cruelty to Children, which was the first child welfare organization in the world. And they were very child focused, very child safety, child protective focused. And it wasn't until I got a position working at a community level, working with families who had been impacted by reports and the court system, as well as working with people who judges and lawyers and social workers in the New York City family court system in particular, that I started realizing that child protection is very well-meaning, right? There's a goal there. There's something that everybody in society should care about. Our policies should be developed to make sure that we're giving all children an equal chance to grow and be healthy and be safe. But that automatically there are people associated with those kids that maybe we're not prioritizing. And they're caretakers, usually their biological parents, sometimes their siblings or other members of the household. And all those people used to be kids too. And if something's happening to a child that isn't what we want it to be, chances are it's happening because of somebody having an adult in their environment not having gotten the support that they needed as a child. And I didn't have that perspective when I got into this work. I was a 25-year-old upper middle class white lady who was, even though I've lived in New York City my whole life, generally sheltered from those direct experiences. And so it wasn't until I started listening to the parents who were accused of abuse or neglect, but the reports were unsubstantiated, did I realize that there were people who were the subjects of these very well-meaning reports, but for whom the reporting structure was not helping them. It was actually hurting them. It was making it hard for them to keep their jobs. It was making it hard for them to sleep at night, because they were so worried, and just those adjustments to their sleeping or their eating then impacted the way they could parent their kids. And so those experiences made me try to think more holistically about the system of mandated reporting. And I've committed myself for the past 20 years to improving the process of mandated reporting so that mandated reporters know better what their legal obligations are. There are laws there that tell mandated reporters what they need to do and when, but those laws are confusing. And sometimes mandated reporters make reports they don't need to be making.
Okay. All right. Yeah. It kind of, it's kind of worrisome. Like, well, gee, maybe I should be much more careful. Not that clinicians are not already careful, but it makes me think it's really important to be careful before making a report, is what I get from what I'm hearing you say.
Yeah. I mean, I'll put things in perspective. There are about 3.5 million to 4 million reports of suspected child abuse and neglect in the United States every year. Mm-hmm. Those reports then get an investigation by their local child protective services unit, and more than half, actually closer to 75% of those reports, do not end up finding abuse or neglect. Uh-huh. And so while yes, if we're talking 4 million reports, that does mean 1 million kids out there are the subjects of a substantiated report who have been found to be abused or neglected. And that is something we should care about as a society. And we need to work to make that number smaller and make sure that those children and those families get the support they need. But what about those 3 million kids and families for whom the call was very likely well-meaning, that there was a concerned provider, often mandated reporter, on that phone call saying, CPS, I'm not really comfortable with what's happening in this household. I want you to go in and investigate. But it makes me wonder, is there a better way? Is there something else that those providers could be doing? And I think that training, education, and honestly, these kinds of conversations are the way we're going to get there.
Yeah, that's interesting because, I'm pretty sure I've heard several times, like, don't worry so much about making a false report. It's important to report, and then, Child Protective Services they'll do their job, and hopefully in a way that's not going to be harmful to the family. But what I hear you're saying is that before making a report, taking on the responsibility to understand maybe what to look for and how to decide whether or not you really do need to make a report.
Exactly. And one of the big pieces of that, right, is something I alluded to before, which is our own positionality as reporters impacts what we see in the families we're serving. And so there's a lot of judgment about parenting. Parents judge other parents, non-parents judge parents. It's a whole culture. It's not just an American thing. Right. I understand that. But that's where I really want people to start. right?
Yeah.
And I remember I actually started doing mandated reporter training before I had my son. And my son's now turning 14. And I think back to the fact that honestly, the first book I wrote on co-wrote on mandated reporting was when my son was an infant. And I had a very strong understanding of the families that I worked with, but from working with them. And, that's why I've written subsequently, and I've tried to be more nuanced with the ways that I talk about parenting since becoming a parent, because I had no idea
Right. Yeah.
what this was like. And again, recognizing my privileges. I often talk about the frustrations of being a new mom and my husband out of work with an injury,
Yep.
and just knowing that I had the supports and that my husband was able to get workers' compensation and we didn't have to worry about income, and my family could, help me out but lots of families don't have that.
Right.
And so I recognize my privileges, and I want to make sure that other reporters are thinking about the families as well in that context.
Yeah. So in terms of the reporting being disproportionate, can you share some information about that? Because that's not something that I'm aware of, and most clinicians are probably not aware of.
Sure. So what's very interesting to understand is that when mandated reporting policy was created back in the late 60s, early 1970s, we were in the middle of the civil rights movement. And so while there was this effort to seek to protect children from abuse or neglect, there was a lot of concern for involving the government, one more way of involving the government with poor families, because unfortunately in the United States, when we have government intervention with poor families, for the most part, they're disproportionately families of color and disproportionately Black families. And so there was a discussion back in the 1970s about the potential for mandated reporting to disproportionately impact communities of color. I don't think they had any idea what that impact was actually going to be like. So let's look at the numbers a little bit. 25% of those 4 million reports every year are of Black kids. 25% doesn't seem like a lot, right? Only 1 out of every 4. But the problem is only 15% of kids in America are Black children. And so there's an overrepresentation of Black kids, as well as in different communities, Hispanic kids, and also in certain parts of the country, Indigenous and American Indian, Native American families. And a lot of that disproportionality has to do with the fact that many of these families are more likely to live in poverty and communities where there's a lot of poverty have lack of access to certain resources, which then creates a cycle of abuse and potential cycle of abuse and neglect. But when research gets down to the nitty-gritty, it's not just about those issues. We also find that there's disproportionality, specifically when we compare reports of private school to public school. So what we see is a phenomenon where private schools are less likely to make reports of abuse or neglect, even when they're there, mainly because they're protecting their institution, because they're afraid that parents won't tell other families to send their kids there. Same thing with daycare providers. And so it's families that end up accessing public services who tend to have fewer resources that then become the ones who get attention. And then there are studies that show in certain cases with certain types of professionals, if there's one case that presents with a white family and the same exact case presents with a Black family, that the professional is more likely to make the report against the Black family. And those are the issues, again, that I'm really hoping that reporters will start thinking about when they're specifically when they're considering reporting families of color, to make sure that they're seeing what this family is presenting, and that they're not just making a report out of bias that they might not even be aware that they have.
Yeah, makes me think like also maybe neighborhood and economic status. So how do clinicians try to work on their bias so that it doesn't impact their reporting? Is it,
And it's not easy, right? Nobody wants to stop and think of themselves as potentially racist, and especially white clinicians or white therapists, right? But in my experience and with my own personal professional development, that's been invaluable to me. And I'm thankful for the people in my life who've challenged me to think that way so that I can better prepare myself. And when I do my trainings, it's helpful for other people to hear me talk about my own struggles and how to explore this area, because there is a lot of work to be done to make sure that that specifically white social workers are not creating more of a problem than they are trying to help. And I think that's when social workers in particular, as we talked about from the beginning, we come to social work because we want to help and we don't want to think about the potential that we could be actually hurting.
And in terms of legal issues, do clinicians end up having legal issues because of either false reporting or not reporting when they should have? So we have the laws, mandated reporting laws. Are those laws enforced?
Very good question, right? A lot of people have a fear of the main driver when you ask mandated reporters why they made a report is they said they're afraid that if they don't make a report, they're going to get in trouble. This is the lawyer hat. I'm going to put my lawyer hat on. I'm going to say it's actually very few and far between that mandated reporters are held to task for having failed to make a report. And the main reason for that is if nobody makes a report, we don't know that the abuse or neglect is happening, except in some really egregious cases. And so when we end up seeing a child fatality, us here in New York City, we tend to have a high profile child fatality every few years, and it makes us re-examine the system. And we try to see where was the problem. But honestly, with most child fatalities, there's usually a history of child abuse, and it's usually a known family to the system. And so it's not a reporting issue. So it's very rare that in child fatality cases that reporters are held accountable for not having made a report. And that's a good thing, because that means that maybe mandated reporters were the ones who made those calls that made the child and the family come to the attention of the system. It's the harder cases to negotiate and navigate, specifically around neglect. Neglect allegations really have a lot to do with judgment about whether there's imminent harm to a child, and usually of their emotional or psychological state. And let's be serious, we all have had a lot of emotional and psychological harm in our lives. I don't mean to laugh about it, but how do you prove that your mental or emotional state is because of a parent's failure? I don't think parents really want to take on that responsibility. So it's really hard to kind of hold a mandated reporter responsible if neglect hasn't been reported, because we don't know that neglect is occurring unless it's been reported. There have been a bunch of high profile sexual abuse cases where mandated reporters, specifically in schools, knew about sexual abuse of a child and they didn't make those reports. And the culture is changing. And we can luckily say that over the past 10 years, there's a greater understanding of the importance of making those calls about suspected child abuse, because we have tens of thousands of people coming forward talking about having been sexually abused by teachers or other leaders in their lives, and multiple people having known about it. And so while there isn't litigation against those mandated reporters who could have made those reports, it's because of statutory limitations, statute of limitations in particular. A certain number of years out, you can't sue a mandated reporter for those things. So that's a long version of the answer to that question. It's few and far between. False reports, because you asked about failure to report. So what I think you mean to refer to is the failure to report, because a false report is when you're making a report you shouldn't have made.
Right, yeah.
And so we talked about failure to report. So the other thing is the unsubstantiated reports. If a mandated reporter makes a report that's not substantiated after investigation, they have immunity from civil and criminal liability in all 50 states, as long as they made the report in good faith. So the lawyer hat comes on, and all I have to tell you about good faith is that if you as a mandated reporter had every reason to believe that what you've seen or been told is possibly true, then you made a report in good faith. You don't need to know that it was true, but if you knew that it was false, if you lie to CPS, then you'll get in trouble. But other than that, mandated reporters are really protected by a whole series of immunity provisions.
Yeah, that makes sense. And do you have, say, two pieces of advice, or one, any piece of advice that you'd recommend to clinicians who are not feeling totally competent in this area at this time?
So number one is reach out for training. There's definitely better training out there. There's a series of great articles you can pick up. But the number one, like the big thing I'm trying to get people to do is talk about it.
Okay.
Talk with other clinicians. Oftentimes clinicians, specifically in private practice, might feel isolated. Lots of people don't want to admit that they don't know what's going on or what they should do. We need to break that. We need to be able to have these conversations. The standard for mandated reporters in most states, the requirement for them to make a report is usually based around reasonableness. Do you have a reasonable suspicion of abuse or neglect? And a lawyer can tell you that reasonable is about comparing yourself to somebody else who has the same information you have, the same training that you have. And would they think what you think about what you saw or heard? And so it's those communications with your colleagues and your supervisors that can help you determine, am I being reasonable? And especially when we're talking to clinicians, right? When you have that tete-a-tete with another clinician, they can tell you, quite honestly, are you being reasonable? Or maybe there's something going on for you. You're experiencing some type of transference to the case that you're seeing, and that's impacting whether you want to make a report or not. And so specifically, clinicians are in a great position to have these conversations with each other.
Yeah, I actually just had my peer consultation group today, earlier this morning, and we've been the same group for many years now, and every one of us, we're totally upfront with each other. If we, don't agree with the way someone's going about something, we share it, in a nice way, but we say,
Right.
this is how I would handle it. This is how I would handle it. And yeah,
we
it's very,
professionals need that check.
yeah, it's very eye-opening. It's so helpful to all of us. That's why we all stuck with it for, I've been in this group for about 9 years. So yeah,
That's great.
yeah, it's very helpful.
And that reminds me of something I tell my students all the time, which is whether it's social work or law, we're talking about professional practice. And practice means that you're always getting better. You're always trying to improve. You're always looking to add to your knowledge or add to your skills. We're not static as professionals in these fields. And so take advantage of every opportunity you can to grow a little.
Yeah, definitely. Well, Dr. Krase, thank you so much. This has been very helpful. And Dr. Krase's publications will be in the description, so definitely check those out. Thank you.
Thank you.